Hey folks, I'm in Connecticut and I'm running against Jim Himes, and there's 5 of us, and there's 2 independents and 3 Republicans. The Republicans get along and try to help each other point out the fact that there's no congressman in all of New England, but that are Republican or conservative or even realistic. So there's a discussion taking place right now about this topic that is a very important topic. Let me tell you what it is. Throughout 2024, judges in Connecticut probate court approved 200 ECT, electroconvulsive therapy patients. Okay? It's a big deal. It's popularly known as electroshock therapy. Not good. Now, what they maintained in the state is that the number was much smaller in 2017, and due to COVID, they jacked this number up due to a crisis. A fake crisis, folks. When you look at the data, it talks about different patients, and every patient's different, but there are patients that you need to really question as to what's going on. If you're misdiagnosed and then you get electric shock therapy, well, that's a really big no-no, because the hospital situation in Whiting is that certain people torment you until you react. Pushing your buttons. Oh, Sean needs a shower. Why would the women go in the shower with him and yell at him the entire time? Of course he's upset. He's naked. He doesn't need supervision in the shower, folks. Not by a woman. And, Haiti is a horrible person. She talks continuously all night long, outside your room, sitting in a chair, and they wake you up every 15 minutes with a flashlight, a laser in your eyes. So you can, if you want to look at some documentation on electric shock therapy, there are sections of this document that you really need to read. Let me try to find one. There's many. Today, most available information places the number of individuals in the United States who receive electric shock therapy at 100,000 patients a year, according to Johns Hopkins. They give you a sedative, then they shock you to, reprogram your mind. And there were 81 in 2015 and 174 in 2025. That's in Connecticut, which is a low number considering if there's 100,000 in the country. But here we are. They start talking about 2 DUMAS, Department of Mental Health professionals, who run CVH, which is Whiting, and they say that because of COVID, temporary shutdown of certain medical and mental health services tipped Connecticut's mental health system into crisis. Well, you know what? You can listen to these professionals speak about the petitions, and the lawyers aren't interested in anything if they don't get paid. But it goes by town how many Middlesex, Bridgeport cases there were. But if you look specifically at some of the data, they're saying that people that are over-medicated have kidney problems and liver problems, then the medication doesn't work, so they switch to something different, which is torture. And they only discharged 6 patients And they go into discussions about ketamine. They say that, for example, I'm going to try to get to one of these exhibits. Find you a good one. Mrs. Levesque is aggravated because she would have been discharged if the force shocks were beneficial as required by statute. So to shock you, there has to be a benefit. Okay? However, Mrs. Levesque remains on a locked unit despite 500 shocks, with the hospital pursuing more shocks rather than pursuing beneficial treatments that could lead to discharge. 500 shocks, folks. 500 shocks. You want to plug yourself into, 20 amps? And here it is. That shock is not beneficial if 500 shock treatments did not lead to her discharge. Here we go. They say they can shock you because it's beneficial. But after 500 shocks, if you're not ready to be discharged, there is no benefit to it. So case after case, appeals pending, driving up the cost. Here we go. This is the key. 2 doctors testified that Levesque was unable to give informed consent because there were times when she was psychotic and down, and said she'd been on everything. However, for example, Chip in Whiting has 4 pages of medication. Some serious stuff he's on, okay? He's on some serious stuff. Long term, he came when he was 21 to Whiting. He's 53 years old, or 54 years old. So the guy's been there for 34 years, 4 pages of medications, killing his kidney, killing his liver, leading him to electric shock therapy. And I wonder if he'll survive much longer. Right now, he sits in the corner and drools all over himself for half the day. And his brother wants to save him, and his sister's interested in saving him too. But here we go. They're asking the attorneys no real legal recourse, even when probate court order is made on unlawful procedure, or even when basic due process protections that already exist are ignored. By the time any appeal could get in front of a superior court judge, the force shock therapy is over. The automatic stay of the probate court and informed consent requirement are fundamental. How do you give informed consent to shock therapy after you've been medicated with 4 pages of crap for 20, 30, 40 years? This is a problem, folks. And it's mismanagement, it's Medicaid fraud, it's a lot of things. But here we go. They talk about legislative sessions where the Public Health Committee, discusses things. The Connecticut Hospital Association, and it goes on and on and on. Middletown Probate Court, Marino, offered testimony in support of an extension. Having presided over thousands of shock therapy hearings, Marino said a current 45-day authorization is too short and does not allow enough time for a true indication of effectiveness of treatment upon the patient. Hold on a second. He's giving thousands of people shock therapy. He admits it. Having presided over thousands of shock therapy cases, after over-medicating them, killed their kidneys and liver, made them diabetic on a high-sugar diet, and, here we are. Tom Burr of the National Alliance of Medical Illness warned that someone who may have consented to the initial treatment may change their mind and would seemingly allow for multiple rounds of shock therapy to be administered pursuant to initial consent. There is no limitation on probate court orders for ECT. Wow. Shock therapy is done when after psychiatry has otherwise failed the patient. So here's Louis in a bed with autism, getting medicated, pissing and crapping all over himself. No one takes him to get food. No one showers him. When people assist Louis, those patients are attacked by the staff. Yes, I witnessed that. So, Whiting needs to be shut, folks. And there's plenty of case law. And even people who say, hey, I had it for a short period of time and it worked. I still deal with emotional issues, just like those events that happened to me back in 2005 and 2006. I became permanently disabled. It was quite devastating. However, he says he still has difficulty concentrating and reading due to the electric shock therapy. That never went away. Well, folks, there are cases in Connecticut. The worst ones are DCF. Are the people running for governor talking about that? No. Do they talk about Whiting and the fraud? No. They need to focus on fixing this state, folks. And the only way to do that is to have meaningful discussions. Hello?
I'm calling from Dr. Mel. Is this John?
Yeah.